I'm a fellowship trained breast surgical oncologist, and today I was quoted in Us magazine for a podcast I did with Ashley Iaconetti, the Almost Famous podcast, in which we talked about Katie Thurston's recent breast cancer diagnosis at the very young age of 34. The reason I went on the podcast and talked to Ashley was so we could both advocate for young women to get checked out immediately and to get breast imaging if you feel a lump, as Katie did. Some of the things that I talked about on the podcast were that young women with breast cancer, we're seeing more and more of them. And I see women all the time in my office who are diagnosed in their 30s, even in their 20s, sometimes due to bad genes, but mostly due to bad luck. So I want to take this opportunity to remind young women, if you feel a new lump in your breast and it's been there longer than 2 weeks, please, please, please get it checked out. And make sure that the person who checks you out, your primary care doctor or your OBGYN, orders breast imaging, either a mammogram, an ultrasound, or both, to make sure that this is not breast cancer. Now, if you live in a state like New Mexico, which is where I am, and you don't have access to a primary care doctor or an OBGYN, then you can see a surgeon like me directly. I am happy to see women in Santa Fe who feel a lump and don't know what to do. I'm happy to order the breast imaging and make sure that it's not breast cancer. If you can't find a surgeon, look for a medical oncologist. Any doctor that treats breast cancer should be willing and able to help you get the care that you need to make sure that something isn't breast cancer as well.